Hi, how are you? This is the Mindfully Integrative Show, and this is Dr. Damaris Maria Grossman. And I appreciate you guys being on today's amazing mindful chat with Dr. Raphael Kellman. He is a functional medicine integrative provider and an expert in the microbiome. So I cannot wait for you guys to learn more about him and his center and what he has done for our community. Thanks so much, Dr. Kellman, for being on.
Oh, it's a pleasure, and thank you for having me.
Yeah, of course. And so I always kind of start in with a little fact that people don't know about you or some little thing that you'd like to share.
Okay, good. I want to tell you, why I got so interested in the microbiome and bacteria in general, and why I was ahead of the curve in coming to this realization and conclusion. One of the things that I've worked on in medicine is ecological medicine, right? Ecological health. So it has a lot to do with the ecology and its preservation and the things that are adversely, unfortunately, affecting it, but also the unseen world of our ecology. And it's so awe-inspiring, this unseen world, that and since I was familiar with it as much as any human being could be, by you know reading about it, seeing pictures, videos. So I that unseen world was a bit more familiar to me, and I always wanted to bring it to the forefront because I think it's so important for people to see it, to know that it's something we really want to preserve, and to know that there's something phenomenal there that could help us in our healing, and to learn something from it. So when you delve into that world, you learn about the beauty and the power of bacteria and how they work so harmoniously and synergistically and in fellowship with each other. Really a great example of working in fellowship and unity. So without bacteria on Earth, there would be no life on Earth. They really started to a great degree, or they were early on in the process of life, the evolution of life, and they were really there pretty much at the beginning, and setting the stage for the development of life in its myriad forms that we see it today. And it's because they produce the carbon and the nitrogen cycle, without which there could be no organic life on Earth. Additionally, there's the genes that they carry, that they're the repository for, is just staggering in number. To try to bring it back home, in us, we know that bacteria outnumber our own cells 10 to 1. But the genetics of bacteria outnumber our genetics 150 to 1. So bacteria are virtually synonymous with a repository of DNA, which is the language of life. They're like the Shakespeare of bacteria, of the unseen world, in the sense that they are the repository of language, of the genetics, of the DNA, which is basically the language of life. And they have such a extensive library of different DNA, and they could shuffle them around and share them with each other, and that ability set the stage for the development of life. Now, additionally, all these bacteria across the earth, and it's staggering, their numbers, and where they're found everywhere, deep in the earth, at temperatures that no one ever thought any life could exist. And they work all in fellowship. So when you know that, you got to know that they're doing something miraculous in the body as well. And that's something that I always understood and believed in, even before uh, the word microbiome actually was in the
Like
scientific
a
literature.
big
So
wow, that's quite
yeah,
phenomenal.
yeah. So then
I'm
once it
so
started,
intrigued. Talk more.
once it started getting into the medical literature, it just, kind of confirmed what I always knew. So in 2007, I wanted to write a book on the power of the bacteria, but it was so, ahead of its time that my agent didn't really get it. It was only in 2014 when I came back to her that they understood. 2013, because there was already a little bit out there um, about it, and that's how I came to this conclusion about the power of the microbiome and to utilize it and harness its power to heal the body. So that's the background. That's the story. So bacteria are like a hero. They're really a hero, and I think if we look at them like that, it will begin to change the way we approach our world, the way we approach health in general.
I mean, you've written a numerous amounts of research and on this topic. I mean, I guess that microbiome is considered all encompassing, but the amount, I mean, of knowledge in this area. What I have a question in the sense of what made us so afraid of bacteria? Like, we talked about it, but then it became to this point where we didn't understand that it had this symbiotic, like you said, fellowship.
Right. I mean, you
It's
have to know the history of the development of medicine
yeah,
and the initial drugs that were
that
first
were
developed, and to also understand that there was always epidemics and we were always battling, so to speak, bacteria and viruses, etc. And we didn't really understand that it's the balance of bacteria that's most important. And then when the balance is off, sure, you're susceptible to infectious diseases. So the paradigm years back and still is today, by and large, is a war. Medicine is about fighting a war, and the biggest enemy is bacteria, right? So they developed antibiotics,
right.
which was a major advancement in medicine, and uh, so, but they were locked into a certain model of understanding that bacteria is bad. So, and that was basically how medicine evolved. Is that there's kind of bad things out there, and we got to defeat it. So there's
Mm-hmm.
bacteria, and now we have antibiotics that could destroy it. Therefore, our health gets better. That was the
The
model of
thought.
understanding. The same thing with cholesterol. Cholesterol became an enemy, uh,
Mm-hmm.
akin to bacteria. So it was a warlike mentality, which fit in perfectly with the development of the pharmaceutical industry.
Mm-hmm.
And
Mm-hmm.
look, it's the evolution of ideas, and this is where it started. Okay, did
Right.
it? Is that a big mistake? Well, it depends on how you look at it.
Mm-hmm.
But in the end, we're coming to a more holistic or ecological understanding. Um, you know, despite ourselves, it's happening behind our backs, and this understanding that bacteria are so important in our health is a revolution in medicine and science today, which is also beginning to change our understanding of how the body works. That it works uh, beyond borders. In other words, different systems affect each other, and they don't have to be contiguous. Especially with the gut and the microbiome, that these bacteria found in the gut, the microbiome could profoundly affect the immune system and profoundly affect the brain and all systems of the body, which means that healing is non-local. It's spread throughout the body and systems are interacting, which is shattering the old paradigm.
Right,
Uh,
right. That's why I have you on, Dr. Kellman.
yeah, I
You're
know. That's why I'm here. I wouldn't be talking to you if you were the president of Pfizer. I would have no interest in getting on.
That's why I'm excited for your knowledge and for your discussion because you get it. I'm not talking to someone that doesn't get it. You're in that realm of understanding the interconnectedness in the body and you've studied it. You're one of those that not just talks about it, you've researched it and see the importance of it, you know.
Yeah.
Um How in your through your path of, your patients or not even just patients through your clinic, what was the I know what do you do? Or shall we say not do, but what's your you see a typical patient that comes in. What's your
Yeah, no, it's a great question. Look, I actually just an hour ago, I just had a patient. The son has autism, ASD, anxiety, so and some gut symptoms. So I recommended specific probiotics
Hmm.
because they're not all the same. I call this, microbiome medicine because it's a very intricate field. It's not just throwing in antibiotics. So to know the research in which bacteria are most beneficial, and what about also their combination? So there's two
Hmm.
approaches: using individual probiotics and
Right.
using many. So, for example, for this kid, I recommended a particular probiotic, Lactobacillus rhamnosus
Hmm.
and Lactobacillus reuteri, and there's great research about their benefits. So, for example, rhamnosus, it improves, it enters into the
The
brain. Uh,
blood-brain barrier.
yeah, yeah,
Uh-huh.
yeah, and also it has profound effects on the unhealthy neurological processes that occur with autism and neurodegenerative diseases.
Okay.
So this
So
one
like a
bacteria in
Parkinson's
the
or a
gut,
dementia. Okay.
exactly. So that's microbiome medicine in practice. So that's one thing. For every patient, irrespective of the disease, I'm looking for the right types of probiotics. So if someone has, let's say, an autoimmune disease, there's a number of different probiotics that have been scientifically studied to show benefits for this type of disorder.
For more
And
like of a modulation to
exactly,
modulate. Right.
immune modulation, and not and there are some specific ones that are most beneficial. So for sure we would use that. And then of course, healing intestinal permeability,
Hmm.
focus on a healthy gut and microbiome is critical for all health issues and all diseases. So that's a foundational piece, microbiome medicine. And of course you want to do stool analysis and look deeper to see
Into the
into the gut,
causes.
right?
Into
You
the
want to see
cause.
like which bacteria that are particularly associated with autoimmune disorders, overgrowth of certain types of bacteria and undergrowth. So that's certainly one uh, important aspect of the type of work that I do. I treat a lot of autoimmune disorders with very frontier kind of treatments. One
I bet.
is like peptide therapy, which is getting more out there. So there's one called thymosin alpha 1, which the body produces. These are small little proteins that modulate different physiological functions. So this one particularly has benefit for autoimmune disorders. And also there are a number of different herbs that help with autoimmune disease, scientifically studied. It's not just,
Mm.
oh, we just know this from tradition. No, there's tremendous science now that show the benefits of different herbs. What my interest is to know which herbs particularly affect certain cytokines or inflammatory markers, and we
Mm.
can measure these inflammatory markers. Then I know, which types of herbs are maybe best for a particular health issue. And then there's research to show which particular types of herbs are good for different types of autoimmune disorders. So, for example, Boswellia is phenomenal for um, colitis and Crohn's disease. And then cat's claw for rheumatoid arthritis. So you want
Love
to
that one.
be specific. You want to be you want to use a targeted, very individualized, personalized approach to healthcare. So, and then we use something called exosomes, which come from stem cells, a very powerful treatment. And this is
Mhm.
our program is reversing a nice percentage of patients with autoimmune disorders, and I mean reversing of some significant types of autoimmune disorders. And again, it's a combination of treatments. It's using novel, very effective treatments like peptides and exosomes, which come from stem cells. So,
You're in the
for
frontier of this. Not, I don't think there's that many providers out there
no,
in
this is all
um,
pretty new. I mean, look, our center, we really have very progressive treatments. We also do UV ultraviolet B light IV, which so you're getting ultraviolet light throughout the body in an IV, which has an immune modulating effect. So yeah, we
I haven't heard of
fortunately,
that before. I've
yeah,
definitely heard of UV lighting. I've definitely heard of IV hydration and
yeah,
different
yeah, you,
modulations, but I've not heard of UV.
yeah. We
Personally,
put
I have not.
light that spreads throughout the body. Light spreads everywhere,
And
and
it's safe and
and
everything.
it has an immune modulating effect. So yeah, I mean, my focus is if there's something good out there in the world, I want it here in our center to help patients get better. That's what drives me.
I love it. That's amazing. I have some two general questions, and they'll probably seem very minimal or trivial to like to you. But when I see patients, right, I like people are just asking me about probiotics in general, and I think I'm in my infancy of understanding it, truthfully. But I was when someone says, "Oh, I'll take certain probiotics," is there a certain amount of CFUs that you recommend? I know you're so in the specifics of which personalized ones to do. I'm
I don't,
trying to just get one into like a women's health. Like a, for example, I have like a woman with a UTI, right? And I'm giving her at least the generic women's health conversation. And I have a few that I know in there. But I tell people, I'm saying on my end, at least 10 billion to 20
yeah,
billion on the CFUs. And I want it to be a quality, obviously probiotic. Um,
yeah,
I didn't even go
that's
into
good.
the realm of which ones yet.
Right, that's good, and you want to make sure it doesn't get broken down by stomach acid. Um, yeah, all that is true. I'm actually developing. I actually produced a small book on all the different types of bacteria, but I'm updating it. I could send it to you, a copy of all the types of probiotics that are good for different types of conditions.
That's excellent. Yeah.
With,
Oh my gosh,
I'll
that sounds
send it to you.
wonderful.
Give me a few more weeks on it because we're updating it, and it will be a great.
Are you
You know,
selling it on online? Will you be selling it
I'm
online?
not selling it. I haven't thought about selling it, but I'll give them out. I mean, I want to have it for patients, but
No,
I'll be
if you end up selling it, I'd love to put it a link in for the on the show.
yeah. Maybe one day we will, but I think it would be a great handout, a great pamphlet, and maybe it's 30 pages, but it will guide doctors, health professionals to know which probiotics are best and some suggestions of which companies contain them.
Of
Uh,
course, yeah.
you know,
Quality that are not,
yeah,
you know.
but people could do their own research to see, maybe they prefer a different company. But most important is that you have the right types of probiotics for the particular condition. It really makes a big difference in outcome. It's really phenomenal.
Right. I think that for me, like as I'm learning on my end, I definitely know that there are specific ones, but because I don't know it like you know it, I'm like, oh, well, there has to be. My second question to you, is in in forms of intestinal permeability or the leaky gut conversation. I have heard people say to me, and this is what the thought of no matter what probiotic I'm giving an individual, if they're have their hydrochloric acid or they have a low acidity or they're having the intestinal permeability issues, that no matter what medicine I give them isn't going to work. Or no matter what probiotic I give them will not work because obviously it needs to be healed first. Is that correct? Or is it that there's
Really,
certain probiotics will be
no, no, not true, because the
not true?
microbiome is the most important component of healing intestinal permeability. So
Okay.
I don't agree with that.
So this is me just like conversations with previous people I'm trying to understand it even for myself so that when I'm informing others and those listening to hear too. So, and I know that you know. So please explain further if you don't
Look.
mind.
If people want to heal a leaky gut, right?
Mhm.
The intestinal permeability. The most important treatment, the right types of bacteria.
That's what
Improve.
I thought. And that's what I was saying to someone. I go, but it doesn't make sense. I'm thinking of it scientifically. And I go, well, if you're trying to heal up that hole, that wound, I call it a wound, but a wound in, I mean, I had to think of it in some, I said, if you're trying to heal it up, the only way to do that is with the right type of microbiome,
Yeah,
I thought too.
yeah,
That's how I was thinking of it, but
yeah. Who maintains a healthy gut wall? The bacteria.
the bacteria. Yeah, yeah.
When
And
does it break
cholesterol.
down? The bacteria are faltering. So yes, but are there other things to do? Of course. There are many compounds that could heal the gut wall. Like glutamine and
Mhm.
many other
Yeah.
things, marshmallow and so many different compounds. And then there are peptides. There's one called BPC 157. You may want to look into that. tremendous for healing the gut wall. I mean, any autoimmune disorder, any gut and leaky gut issue, BPC 157 is a phenomenal peptide. It helps the healing of the gut wall. It accelerates it tremendously. So it's a comprehensive approach. You have to go at it from multiple angles, and people will see benefit. Some people particularly say to me, wow, that BPC 157 turned everything around. And then there are others that will say, I noticed it's the probiotics. But most really don't even say it's this, that, or that. They just say, hey, I'm feeling better. Who cares what's doing it, right?
Yeah.
Um,
Yeah.
that's the way to go.
And then you look at obviously look at the whole approach. So it's like, are you hydrating? Are you sleeping? Are you, when you obviously are looking at the microbiome, but you're doing a whole approach. So you're not just doing one part of this. This is a combination of.
Absolutely. I
Yeah.
think that's what holistic medicine is
Yeah.
about. It's not a magic bullet approach.
Exactly.
So yeah, it has to, you have to come at it from a few different angles to see the best results.
For my last question for you is on majority of your patients, you said are in the autoimmune but you were also saying neurological, like an autism. That's pretty profound. I think that's people need to know that these are what kind of autoimmune you said, like, or all
Well, yeah,
cases.
all of them. I mean, and some pretty serious, like scleroderma, which is could be a deadly autoimmune disease. I have a patient. They told him that basically they gave him like a life, basically they gave him a death sentence, and he's alive and well, doing great. A young kid, he's doing great with all these treatments. It defies their understanding and their prognoses and their treatment. So it's when I say there, I mean a conventional approach. There's so much that can be done, and I'm talking about reversing these disorders,
Mm-hmm.
uh,
Mm-hmm.
autoimmune, whether it's Hashimoto's, lupus, scleroderma,
Mm-hmm.
Wegener's granulomatosis, uh, rheumatoid arthritis, uh, even myasthenia gravis, multiple sclerosis, and ulcerative colitis, Crohn's, some very serious ones. And fortunately, thank God, we're seeing great results. So that's it. Yeah, absolutely. That's something that, and of course, I deal with a lot of gastrointestinal symptoms
Mm-hmm.
because people know that improving the microbiome, they come to me after they've gone down the road and seen, 10 other doctors, and then they come to see me. And then we work on the microbiome in the right way, in the best way
Absolutely.
that we know of, based on the research, based on, it's an art also.
You
It
almost
it
I do you have to have a class? I mean, you're gonna have to teach this to all like medical, and I mean I'm a nurse practitioner, so I've doctorated, but I'm saying you need to have a full on,
I
like,
would love to.
you
Yeah,
know what I
listen.
mean? At like in long term there, and this is just me as a on the end, I'm saying in the long term, I'd love it if you had this as a something that has
I
to be
would be
in the books, in the
happy to.
courses, like a necessity.
Yeah, if I get invited to something, I'll come.
I know that there's that back and forth, but or even you just make it, but because it's one of those um I think it's a necessary conversation and learning curve for those that obviously that want to learn, but parting.
Where are you located, by the way?
I'm in New Jersey, New York area. How
Oh,
about you?
very nice. Very
Yeah.
nice.
Yeah.
Thanks for finding me.
Oh yeah, I can't wait. So I feel like I'm gonna have to go to your clinic just for my own stuff.
I would love to meet you in person, and we'll keep in touch. It's great. It's great that you're doing this.
Yes, so I can't wait. So that I know that you're not too far from me. So I feel like I want to just meet you, and then I want
Oh,
others to get a hold of you. So how can they reach you? I know that you've written 4 books, 5 books. How many books has it been?
I mean, the total number of books I've written is about 11, but
11. See? Don't even
yeah,
listen to me. I
uh,
apologize. You've written 11 books. My apologies.
yeah, nah, don't worry about it. Some of them are so old already, it's becoming fiction. Some of them I wrote about 12, 13. But even, look, even the microbiome book, it was 2014. So it's already,
I
it's
mean,
time.
the microbiome thyroid, the microbiome diet, microbiome breakthrough, the whole
Right.
brain gut
The whole brain,
reaction.
right. The whole brain matrix healing. And then I've written a few smaller books on the microbiome for different disorders. I can send you copies of these.
This is
I'll get all your information.
Well, I'm gonna have your information in the show notes too, because those listening, I want them to read your work because
Thank
I
you.
want people to understand how important this is. When I learned about the biome like I said, in my infancy and what it's done for me and what I feel I know small, it's helped me significantly for
Yes.
my health stuff. And
Yeah.
I don't even think I'm 100% managed. It's just I almost tell people, please know what you're putting in your body.
Yes. 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 Yeah. No, it'd be if anyone wants to get in touch, I could. It's kellmancenter.com.
HellmanCenter.com. Okay.
Right.
Oh,
Our phone number is 212 717 1118.
wonderful. And your most recent book right now is what, the microbiome thyroid.
Microbiome thyroid. Yes.
Excellent.
Yes.
Excellent. You're talking a lot about like the Hashimoto's and
Yeah. We
or
talk a
just
lot about thyroid.
all thyroid.
Right. Right.
That's
Exactly.
awesome. I think it's important because I think a lot of women, I mean, even on my end, women that I see, I feel like the thyroid conversation is like the norm. It's just it's
Oh,
almost rampant. And I don't know how it is for you, but I feel like
it's all,
80% of my
yeah.
population has some thyroid
Yeah.
issue.
Yeah. Yeah. I totally agree. It's an epidemic. I totally agree. We're on the same
You
page.
do? Okay. Just wondered. I was like, I feel like almost all the women that I see have it. Uh,
Absolutely. Absolutely.
myself included. Who knows? I mean,
It's
not
all,
anymore, but maybe.
it's all over the place.
Yeah.
Yes.
Um, but I really appreciate you being on and thank you so much for your time and your wealth of knowledge. There's plenty more that I know we could discuss. Um, do you have anything that you would like to lead the audience?
You know, it goes back to sort of what I was saying before, that it's the unseen components, and it's frequently what's not spoken about sufficiently that's playing such an important role. I think, in addition to the bacteria, um, the state of mind and our emotional past, our how we are existing day to day, what's our spiritual or existential state of how we approach our lives, which heals our background and traumatic experiences of our childhood, which we know now plays a significant role in terms of the development of diseases, autoimmune diseases, many diseases. And it always disturbs me that you go to, I don't go like I used to, but functional medicine conferences are not focusing enough on the deeper causes. And it's not just about the nutrients that you're missing or which supplements to take. And it's really more about your emotional state and
Right,
your
right. Your
and
stressors, your
that
stressors.
preclude the regular functional medicine, but that has to be focused on. And the good news is there are ways of repairing that past and healing, and that's your state of being today, your spiritual existential state that heals the past. It could transform the past. On CNN, I don't know if they still have it. They have the Heroes Award, and and all these people that have done such great work in the world. A common denominator of all these people is that they've had significant trauma in their lives, in their
Mm.
childhood, and what they've done was to transform that pain and that suffering into something positive, to offer the world and other human beings, other people, uh, a healing that they need themselves and needed themselves, that came from their trauma. And now their understanding of other people's pain and helping them heals heals these people, heals the ones who
I
develop these
I
programs.
I cannot believe it. Well, I mean, I started this podcast and my work because of my own, I completely agree with you. I would have
So you
I'm healing because of, like
exactly,
helping others. I could not agree
exactly,
with you from a
exactly,
my own personal state, not even going into it, but yeah, I agree. I completely agree.
exactly, exactly. And that's really what heals. And I
Mhm.
mean, you're giving out information, healing information to so many people. That is a great act of giving, and that transforms your past.
Mhm. Yeah.
and so many other people. And I see this all the time, that that is the magic formula for healing. Everything else is secondary.
Really. That's so profound. I didn't even look at it fully like that. I saw parts of that, but I that's great. That's good to know. Thank you. I mean, I just that's really profound. Thank you for saying that.
And thanks for having me, Selma. I really appreciate it. Thank you.
I do. I really appreciate you being on, and maybe at some other time we'll have you on again.
Anytime. It'll be a pleasure.
All right. Thank you again. And those listening, thanks so much for listening and watching, and make sure you find a mindful way each and every day.